Question 1. A nurse is educating a patient newly diagnosed with vitamin D deficiency. What instruction is most important? A. Recommend over-the-counter calcium supplements alone. B. Instruct the patient to increase sunlight exposure without sunscreen. C. Educate the patient to take vitamin D with a fat-containing meal. D. Encourage complete elimination of dairy products. Answer. C. Educate the patient to take vitamin D with a fat-containing meal. Question 2. Which patient should the nurse see first? A. A patient with chronic fatigue who reports muscle weakness. B. A patient with vitamin D deficiency and new onset confusion. C. A patient with osteoporosis requesting dietary advice. D. A patient who missed one dose of vitamin D supplement. Answer. B. A patient with vitamin D deficiency and new onset confusion. Question 3. Which task can be delegated to the UAP for a patient with vitamin D deficiency? A. Assess for bone pain. B. Administer vitamin D supplement. C. Report patient-reported fatigue. D. Evaluate lab results. Answer. C. Report patient-reported fatigue. Question 4. A nurse is teaching a group of elderly clients about vitamin D. Which information is most important? A. Vitamin D is only needed for bone health. B. You can stop supplementation after 2 weeks. C. Sunlight exposure may be less effective with aging. D. Dairy intake alone is sufficient. Answer. C. Sunlight exposure may be less effective with aging. Question 5. What lab value most directly confirms vitamin D deficiency? A. Serum calcium. B. Serum 25-hydroxyvitamin D. C. Serum magnesium. D. Serum phosphorus. Answer. B. Serum 25-hydroxyvitamin D. Question 6. Which patient requires immediate provider notification? A. A patient who reports mild joint pain. B. A patient with a serum calcium of 11.5 milligrams per deciliter. C. A patient with vitamin D level of 20 nanograms per milliliter. D. A patient with slight fatigue. Answer. B. A patient with a serum calcium of 11.5 milligrams per deciliter. Question 7. Which food should the nurse recommend to increase vitamin D intake? A. White rice. B. Fortified milk. C. Leafy greens. D. Oranges. Answer. B. Fortified milk. Question 8. The nurse is evaluating teaching effectiveness. Which statement indicates correct understanding? A. I can stop the vitamin D supplement once I feel better. B. I will take my supplement in the morning with breakfast. C. I will limit my calcium intake while on vitamin D. D. I only need vitamin D if I break a bone. Answer. B. I will take my supplement in the morning with breakfast. Question 9. Which clinical manifestation is most associated with severe vitamin D deficiency? A. Constipation. B. Tetany. C. Rash. D. Increased appetite. Answer. B. Tetany. Question 10. The nurse is caring for a postpartum woman with low vitamin D. What should the nurse prioritize? A. Discontinue breastfeeding. B. Encourage high-dose vitamin D without provider order. C. Recommend vitamin D drops for the newborn. D. Instruct to avoid sun exposure. Answer. C. Recommend vitamin D drops for the newborn. Question 11. A patient asks about the best time for sun exposure to boost vitamin D. What should the nurse say? A. Before 7 a.m. B. Around noon for 10 to 15 minutes. C. After 6 p.m. D. During heavy cloud cover. Answer: B. Around noon for 10 to 15 minutes. Question 12. Which statement by a nursing student requires correction? A. Vitamin D helps absorb calcium. B. Vitamin D can affect immune function. C. Vitamin D is stored in fat tissue. D. Vitamin D is water-soluble. Answer: D. Vitamin D is water-soluble. Question 13. What is the nurse's priority when a patient reports muscle cramps and vitamin D deficiency? A. Provide warm compress. B. Notify the provider. C. Encourage rest. D. Offer electrolyte drink. Answer: B. Notify the provider. Question 14. What should the nurse monitor in a patient on high-dose vitamin D therapy? A. Potassium levels. B. Calcium levels. C. Magnesium levels. D. Iron levels. Answer: B. Calcium levels. Question 15. Which patient is most at risk for vitamin D deficiency? A. A construction worker in Florida. B. A retired woman living in a sunny area. C. A young athlete on a balanced diet. D. A dark-skinned adult living in a northern state. Answer: D. A dark-skinned adult living in a northern state. Question 16. The LPN asks to reinforce teaching on vitamin D. What should the RN consider? A. Assign the LPN to interpret lab results. B. Allow the LPN to assess for bone tenderness. C. Allow the LPN to explain side effects of supplements. D. Allow the LPN to provide written dietary information. Answer: D. Allow the LPN to provide written dietary information. Question 17. A patient taking anticonvulsants is at risk for vitamin D deficiency due to what? A. Increased absorption. B. Drug-induced metabolism of vitamin D. C. Reduced protein intake. D. Calcium retention. Answer: B. Drug-induced metabolism of vitamin D. Question 18. Which supplement pairing is most beneficial in managing vitamin D deficiency? A. Vitamin D and potassium. B. Vitamin D and calcium. C. Vitamin D and iron. D. Vitamin D and folic acid. Answer: B. Vitamin D and calcium. Question 19. What is the expected outcome after 3 months of vitamin D therapy? A. Worsening fatigue. B. Decreased serum calcium. C. Improved muscle strength. D. Development of hyperkalemia. Answer: C. Improved muscle strength. Question 20. The nurse receives 4 patient calls. Which should be prioritized? A. A patient on vitamin D reporting mild nausea. B. A patient experiencing new tingling in fingers. C. A patient who missed 1 dose. D. A patient with questions about diet. Answer: B. A patient experiencing new tingling in fingers. Question 21. What assessment finding in a patient with vitamin D deficiency requires immediate intervention? A. Complaints of fatigue and lethargy. B. Mild lower back pain. C. Positive Chvostek sign. D. Loss of appetite. Answer: C. Positive Chvostek sign. Question 22. Which patient should the RN assess first? A. A patient newly prescribed vitamin D who is unclear about dosage. B. A patient on long-term steroid therapy with recent leg cramps. C. A patient requesting a refill for vitamin D drops. D. A patient who reports they forgot to take vitamin D for 2 days. Answer: B. A patient on long-term steroid therapy with recent leg cramps. Question 23. Which action by the nursing student requires correction when caring for a patient with vitamin D deficiency? A. Educating the patient about foods rich in vitamin D. B. Administering supplements with water on an empty stomach. C. Encouraging safe sunlight exposure. D. Monitoring for bone tenderness. Answer: B. Administering supplements with water on an empty stomach. Question 24. What is the nurse's priority teaching point for a breastfeeding mother with low vitamin D levels? A. Breastfeeding protects infants from vitamin D deficiency. B. Infants do not require supplementation. C. Infants may need vitamin D drops daily. D. Sun exposure is not recommended for infants. Answer: C. Infants may need vitamin D drops daily. Question 25. What lab value should be monitored to avoid toxicity in a patient on high-dose vitamin D? A. Hemoglobin. B. Calcium. C. Sodium. D. Glucose. Answer: B. Calcium. Question 26. A patient with vitamin D deficiency asks about natural sources. What is the best response? A. Leafy greens and apples. B. Fortified cereals and egg yolks. C. Lean meats and white bread. D. Beans and carrots. Answer: B. Fortified cereals and egg yolks. Question 27. What is the best nursing intervention to promote vitamin D absorption? A. Encourage intake with high-fiber meals. B. Recommend taking supplements at bedtime. C. Advise intake with fatty foods. D. Take with iron supplements. Answer: C. Advise intake with fatty foods. Question 28. What is the nurse's best response when a patient refuses vitamin D supplement due to side effects? A. You must take it no matter what. B. Let's discuss alternatives like diet and timing. C. Stop it for now and restart later. D. Skip today's dose and double tomorrow's. Answer: B. Let's discuss alternatives like diet and timing. Question 29. A patient is prescribed ergocalciferol vitamin D2. What should the nurse clarify with the provider? A. The route of administration. B. The frequency of dosing. C. The need for calcium supplementation. D. The patient's renal function. Answer: D. The patient's renal function. Question 30. Which of the following roles is appropriate for the UAP? A. Evaluate patient understanding of vitamin D instructions. B. Monitor for signs of tetany. C. Provide oral supplements already prepared by RN. D. Adjust supplement timing. Answer: C. Provide oral supplements already prepared by RN. Question 31. A patient with chronic kidney disease and vitamin D deficiency is at risk for which complication? A. Hyperkalemia. B. Osteomalacia. C. Iron deficiency anemia. D. Hyperglycemia. Answer: B. Osteomalacia. Question 32. Which action should the nurse take before administering calcitriol? A. Check white blood cell count. B. Assess for liver enlargement. C. Review serum calcium level. D. Check blood pressure. Answer: C. Review serum calcium level. Question 33. A patient reports taking large amounts of vitamin D daily. What symptoms suggest toxicity? A. Excessive salivation. B. Nausea and vomiting. C. Night blindness. D. Bradycardia. Answer: B. Nausea and vomiting. Question 34. What nursing diagnosis is most appropriate for a patient with vitamin D deficiency and muscle weakness? A. Impaired physical mobility. B. Risk for infection. C. Disturbed body image. D. Risk for electrolyte imbalance. Answer: A. Impaired physical mobility. Question 35. The nurse is reviewing discharge instructions for an elderly patient. Which teaching is priority? A. Avoid all supplements unless prescribed. B. Stay indoors to prevent skin cancer. C. Discuss fall risk related to muscle weakness. D. Walk barefoot for bone stimulation. Answer: C. Discuss fall risk related to muscle weakness. Question 36. What is the best time to draw a serum 25-hydroxyvitamin D level for accurate results? A. In the evening before bedtime. B. 2 hours post-supplement. C. In the morning fasting. D. After a high-fat meal. Answer: C. In the morning fasting. Question 37. What would concern the nurse when reviewing the chart of a patient with long-term phenytoin use? A. History of ankle sprains. B. Recent complaints of blurry vision. C. Fatigue and vitamin D level of 12 nanograms per milliliter. D. Vitamin D intake of 1000 IU/day. Answer: C. Fatigue and vitamin D level of 12 nanograms per milliliter. Question 38. What priority teaching should be given to a vegan patient regarding vitamin D? A. Recommend animal-based supplements. B. Promote dairy as the only source. C. Suggest fortified plant-based alternatives. D. Avoid discussing food sources. Answer: C. Suggest fortified plant-based alternatives. Question 39. A nurse is assessing an infant with delayed milestones and low vitamin D. What should the nurse expect? A. Hyperactivity. B. Rigid limbs. C. Rickets and soft bones. D. Excessive hair growth. Answer: C. Rickets and soft bones. Question 40. What teaching is essential for a patient prescribed vitamin D and calcium supplements? A. Take both supplements on an empty stomach. B. Separate vitamin D and calcium doses by 6 hours. C. Take both with meals to enhance absorption. D. Avoid taking them on the same day. Answer: C. Take both with meals to enhance absorption. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!